All right, good morning. I'd like to talk to you about aspirin and upper gastrointestinal bleeding. There's a recent study published, February 28th, 2011. And basically they looked at the risk of upper gastrointestinal bleeding with low-dose aspirin alone or in combination with clopidogrel, which is also called Plavix. And they looked at other medicines. And the reason that's important is because although aspirin, Plavix, and other medicines are good in that they can help protect against heart attacks, and aspirin, of course, has other advantages as far as a pain reliever and an anti-inflammatory medicine. The worry is that these drugs are known to be associated with GI bleeding, that is gastritis and ulcers, and so the question arises, how much? When do you see this? And it's particularly important for many gastric bypass patients because our research and that of others looking at gastric bypass patients with the Roux-en-Y demonstrates that there's a high risk of getting bleeding or perforated ulcers. So basically the study evaluated the risk of what they call upper gastrointestinal bleeding, or UGIB, associated with low-dose aspirin. So again, there is a difference in the risk of low dose, which is anywhere from 65 to 300 milligrams of aspirin a day, and higher doses where you take several tablets of the 300 milligrams a day, more for pain or inflammation. So we're going to talk about low dose in our study today. They looked at the Health Improvement Network in the United Kingdom. And basically the good thing about their healthcare system in England is they have everybody in a computer database, which I don't know, in America might make you a little bit frightened, but it's got some powerful capabilities. So they looked at the database for everybody between age 40 and 84 who might be taking aspirin, and they found a total of 2,049 patients. And they matched that with a group of people who, about 20,000 people who were not taking aspirin. Okay? Then they looked at those people taking aspirin plus those taking Plavix and other medicines like ibuprofen and other drugs like that to see what's what. All right, what they found is aspirin just about doubled the risk of getting a bleeding ulcer. So they found that if you added Plavix to that, that doubled it almost again, and that they found other things like corticosteroids also increased the risk. And so overall, basically, aspirin causes an increased risk of bleeding, not that surprising, and Plavix adds to that, and so the risk is increased further in those taking low-dose aspirin along with oral anticoagulants, non-steroidal anti-inflammatory drugs like ibuprofen, or other medicines. So back to our recommendations for our mini gastric bypass patients. We say to our patients, don't take aspirin, don't take ibuprofen, don't take drugs that cause bleeding like that, because what we found is bleeding is also caused by our surgery itself. Okay? Yesterday, I think we had a great experience because we saw some of the benefits of the surgery, and there are tremendous benefits. There are tremendous benefits of the surgery. And we talked about curing diabetes and high blood pressure and lowering your cholesterol and helping your breathing, and there are real benefits. But again, it's important to point out there are risks that are serious, and we want to talk about those things, make you aware of those things, and particularly aspirin, Plavix, and drugs like that. Let's be careful out there. So